Hi, I'm Parminder. I'm the director and principal physical therapist at Move Physio, and today we are going to talk about shoulder dislocation. So this video I'm making basically to make people aware about the role of physical therapist in shoulder dislocation. So we are not going to talk in too much detail, but briefly about shoulder dislocation. So shoulder can dislocate in three different directions, that is in front, backwards and downwards, but mostly the dislocation happens in the front direction. Okay, so whenever there is a shoulder dislocation, the patient complains of pain, swelling, more of weakness in the arm and bruising. And besides that, there can be more of numbness, tingling sensation in the arm, hand or fingers. Also, there is an immobility of the arm and shoulder feels out of place. So in anterior shoulder dislocation, there can be some kind of combined injuries happening besides the shoulder dislocation itself. So what can happen, that bone can fracture, which is mainly the shoulder bones are there, which when the impact happens between the two bones, there can be fracture of we say it greater tubercle or the head of humerus, and besides that there can be labral tear as well. So all these structures are kind of involved in the shoulder joint dislocation, and then when that happens we call it as Hill-Sachs lesion. And besides that, there is also Benkart's lesion, which happens when the more of glenoid labrum it is torn or it is damaged majorly in the front and little lower part of the shoulder joint. Okay, so now the this lesion of the labrum, it's called the Benkart's lesion. So these two problems can commonly be seen along with shoulder dislocation. So Benkart's lesion can be osseous or bony, or can be fibrous. Okay, so whenever there is a Benkart's lesion, there is a more chances of recurrent dislocation of shoulder, and this specifically happens in people who are younger than 30 years of age. And whenever shoulder dislocation happens in the older age group, so at that time there is a rotator cuff tear chances are more. These are kind of the muscles which surround the shoulder joint. Okay, besides the dislocation of the shoulder, which happens mostly in front, there can be backwards dislocation. We call it posterior shoulder dislocation, which happens generally due to the electric shock, seizures, but they are not commonly seen on radiographic pictures, or you can see them like nearly 50% of times on x-rays, but they are generally missed. Okay, and there are certain movements which can actually help in identify whether the person is having the shoulder dislocation or no. So especially when it is in the front, the person might be it might be difficult for the person to touch the opposite shoulder. Okay, so when a person cannot do that, that means there is a more of dislocation of the shoulder in front region. And whenever there is a backward kind of dislocation happens in the backward direction, there is a difficulty in performing this movement. Okay, the person cannot move arm this way. Okay, so the first thing which we generally do is immobilization, or do not allow the shoulder to move, which again it's that time the doctor's role, orthopedic surgeon's role come first. So they generally reduce the or bring it back to its original position, and then immobilize the joint. But there can be some associated injuries along with the shoulder dislocation. There can be nerve injuries, there can be trauma to other structures, like we have said about the rotator cuff or the muscles surrounding the joint. They can also get damaged. So surgery is mainly recommended for people who have more of recurrent instability. So there's a more this joint is kind of more likely to get dislocated. So if people are like, or the person is facing that problem, in that case the surgical intervention is generally performed. Okay, next comes the role of physical therapy. So if we can divide basically physical therapy in three different phases. So first phase is more of like in first 6 week, where we enhance more of stability of the joint, and we ask the person to perform certain exercises which can help in improving the shoulder joint stability. Then next is the 6 to 12 weeks, where we train the person more for the movement, and specific kind of movements are done. And then from 12 to 24 weeks, where there is a return to like sports activity, if the person is a sports player, or more towards normal activity is enhanced. So for that also there is a special set of exercises. So as I said in the beginning, this video I'm making to make people aware that there is a like specific physical therapy protocol which we follow, but there are many people out there who do not know about it, and they are kind of totally unaware of the role of physical therapy in shoulder dislocation. So yeah, if you or anybody who is suffering from this issue, do meet a physical therapist as well. And yeah, we can plan your therapy according to the condition. All right, so with this I would like to end this video. Thank you so much, and I will meet you soon with another interesting topic. Bye.